have two cases with full arch crowns. Everything has been completed, final lab procedures. These cases were started 2 or more months ago with the potential changes in occlusion puts them at more risk for crown fractures and more potential emergency care. My plan is finish them ASAP and they can be done. What is your recommendation?
Obviously it's to everybody's judgment and it's to everybody's common sense. Cementing those crowns or finalizing the case is not emergency treatment. Period. That's something that you cannot even argue. And I'm not saying it's a wrong thing to contemplate it and think about it and discuss it. Quite the opposite. We are here, almost 500 people, and I think next time we'll have 1,000 because we capped at 500. We are in a safe haven where we can ask these questions and not be looked down upon. Cementing crowns or finalizing a case that is almost finished is not an emergency treatment. Hence, in my opinion, the patient should wait until those guidelines change. And what we need to be good about is explaining to the patient, yes, we could do it, but right now, the best place for every person is to be home. To be socially isolated. If I could be home, I would be home too. I need to see emergencies, and we're running this broadcast for you from the office. But the best place is to be home. So I talk to my patients like I talk to you right now. So it's not an emergency, and the patient needs to be home because we don't want the patient to drive their car to the office, give their car to the valet, go back, come here. This virus is contracting, even if it doesn't cause disease or not a severe disease, it's contracting. It's going to hit the person who is susceptible. So we have to play a role. Now, if you decided to finish this case and you say, you know what, I just want to get it over with, I have the time, then it's your judgment. I'm not going to criticize you. I'm not going to shame you in public and tell you you're a bad person. No, my opinion is different. I'm following the higher up recommendations from the ADA, and the ADA is not always right or is holy like the Vatican, but it's a starting point. And I want everybody to realize this thing is bigger than us. Our collaborative effort is bigger than us, and we see it in our community. Our community is exploding with people joining, because we all are in confusion and we don't have the clarity. And that's what we're trying to do now. So I'm not going to be wishy-washy and tell a doctor, maybe do it, maybe not do it. My recommendation is, it's not an emergency. Find the skills of communication to tell your patient it's not an emergency and don't do it.